using the back balls through the lower back. So Lily's got the black ones here, but you may also be using the red. Naturally, the lower back curves away from the ground, so there's different ways to add that pressure than what there are for the upper back. So your first step you want to do is just lay on your back with your knees bent and your feet flat, and just place the back ball, generally starting in the middle of the lower back, and then just laying back on it like that. Now the way we're going to increase the pressure here is actually by pulling the knees up towards the chest, and that's just going to flatten your back in towards the ground. And you can dictate how much pressure you sort of put into it by how far you bring those knees up, and you'll feel those differences. Now you can just find that one position, stay there for 20 or 30 seconds, and then reposition it up and down throughout the spine. If you feel like you want to be getting some altered pressure on and off, there's a few things you can do. So firstly, you could slightly roll to one side, and that's going to increase the pressure on that one side. And again, you could just hold that position for your 20 seconds or so, or you might choose to just gently oscillate back and forth, either going from neutral into that one side, or you might go all the way from left all the way to right and back again. Another way you can alter that pressure, so you can increase or reduce how much you're bending the knee, and you can bend just one knee up more than the other, and that's also going to put more pressure on one side. So you sort of really just do that there, where we're bending one up more. It's going to, in this case, it's going to put more pressure on that left side. You may choose to still support the other leg at the same time, just based on comfort. You can also go in and out of those knees to chest, so you can bring the knees further up to the chest and just rock in and out of that, and again you're going to feel that repetitive pressure on that one spot. And you can also do that by bringing up the knees towards one shoulder, so diagonally across the body, and then you're getting that increased flattening of the spine as well as a little bit of rotation. And again, you may just hold that position, or you may rock in and out of it. They're the main ways that you're going to sort of change that pressure with this one. But again, just finding that level that may have some discomfort, but it's tolerable. And if in doubt as to what pressure or what position, then just discuss with your physio.